Are your progressive lenses making you more dizzy? We're going to look at that and talk about it a little bit in this video. Welcome to the Vertigo Recovery Doctor. I'm Dr. Kevin Smith, and I want to not only help you figure out what's causing your vertigo, but also how you can help you recover from it. The best way to get my help is to hit that subscribe button and the little bell next to it to get notifications on when I come out with new helpful videos. So this video, we're talking about progressive lenses and vertigo. Now, if you are wearing progressive lenses and you're having dizziness because of BPPV, this isn't necessarily going to apply because you can fix that pretty easily. There's just these little crystals that get displaced in the inner ear and put you through maneuver. There are 3 different positions typically to put those crystals back where they're supposed to go. Now, sometimes that can cause some disruptions in how the brain processes information, even with BPPV. So maybe it might apply, but not typically. If you need help figuring out if you have BPPV, or if you need help on the best maneuver for you to help get rid of your BPPV, check out my Vertigo Kickstart mini course. You can find the link below. And I guide you step by step on how to figure out if you have it and what to do for it. Now, for other conditions like let's say a vestibular neuritis, like more chronic problems, vestibular migraines, 3PD, even with cervicogenic dizziness, more chronic issues, the progressive lenses or monovision might cause some of the problem or be making your symptoms worse. Now, imagine if you have some kind of disruption in your sensory systems and your brain is having a hard time processing all of that information. So if there's some kind of change, sometimes the brain just has a difficulty matching everything up, and that's when we need to do exercises to help get your brain to adapt back to normal. Now, if your brain's already having a difficult time processing all that sensory information and the changes and adapting to those changes, if you have progressive lenses that add a lot of visual information into the brain, that's just going to make it more difficult for it to recover and maybe even contributing to some of the symptoms that you're experiencing. Now, just imagine going through those progressive lenses, looking at the top down to the bottom. You're already feeling disoriented, and kind of moving through that kind of gradient of visual changes is probably going to make you feel even more disoriented. It might have been okay when you didn't have any kind of vertigo or didn't have any type of dizziness, and you were able to kind of offset that with or process it a little better, or you could have more brain power going to processing that information and you already felt grounded. But if you're feeling dizzier and you're having vertigo and you're now looking through those progressive lenses, you're already feeling dizzy and off balance, and having some kind of change in your vision is probably gonna make things more difficult. And the reason is because when there's some kind of disruption in one of your sensory systems, usually the visual system is the one you become more dependent on. And if you're not able to really focus clearly on a visual target that's going to help you keep your balance and stability, then looking through progressive lenses or having monovision is going to make it a little bit more challenging to utilize that visual system as the system that's going to keep you stable and balanced. Now, it's not the one that we want to use most of the time because your vision is easily fooled. We want to utilize it in more of that inner ear system. But that's when those vestibular exercises come into play and are really important in trying to help your brain prioritize which system that you should be using. Now, this doesn't mean that you can't go back to using progressive lenses or monovision, but I would suggest that you probably first, if you have the ability to, if you have another set of glasses or something like that, if you have the ability to first take care of the vertigo, take care of the balance issue, take care of that dizziness that you're experiencing, and then once you're feeling a little bit more grounded and stable, then maybe try the lenses again. Now, if you don't think they're causing a problem, maybe you've tried with and without them and it's not, doesn't make your dizziness worse or better or anything like that, then maybe this might not apply to you. But it's just one thing to consider when you're trying to recover from vertigo, that, okay, well, maybe you should switch out to, regular lenses, and just do lenses for close up and lenses for far away versus having them all in one. And especially if you have chronic vertigo, I would really consider not switching to progressive lenses or switching to monovision either. So, make that a part of your decision making if you're thinking about doing it, because it's just going to be another layer for your brain to have to compensate for, or another layer for your brain to have to process information for. So yeah, the big takeaways, something to think about, right? We have all these different sensory systems, and we want to make sure that the brain is processing all that information appropriately. Now, if you have disruption in one of the systems, then adding something on top of that with the system that you're probably using to keep your balance most of the time is just going to make you feel more dizzy and more off. So I hope this was helpful for you. If you are having a hard time figuring out what's causing your dizziness, you can check out my free ebook in the link below on the 5 most common causes of dizziness and how to recover from them. It's geared towards trying to help you figure out what's causing your vertigo, which is why another big reason why I have this YouTube channel is because I want people to figure out what's causing their dizziness so that they have the power, and they have the knowledge, and they have the information to feel in control of what's going on, to have some kind of knowledge, to have power over what you're experiencing. So grab a copy of that ebook, and if you have any questions, feel free to reach out to me, feel free to email me, and you can check out my other videos as well. I have another kind of a video that's pretty similar to that ebook on the 5 dominant causes of vertigo. And then I also have another video that I'll link to in the notes before on kind of almost all the different causes, not all the different causes of vertigo, but almost all the different causes of vertigo. I break down system by system in the body, and I break down by diagnoses and kind of talk about each of the diagnoses a little bit. And to give you kind of an idea of what can cause vertigo, and also to give you an idea of what each might present like, or what some of the common symptoms are with them. So grab a copy of that ebook. If you have any questions on or need help figuring out what's causing your vertigo, please feel free to reach out to me. And I hope this was all helpful for you. And thank you for watching.